Are you suffering from recurrent chest pains and you've been told that there is nothing wrong with your heart, but you keep on getting the chest pains? Well, this is one of the common reasons we see in our day-to-day gastroenterology practice, that patients have been told that this could be gastric pains. How do we know this is gastric? Are there any symptoms that can point? Is there anything that you can do at home to try and solve this problem? Watch this video until the end. You will find all the answers to tell whether you're suffering from gastric chest pains or heart-related pains and what you can do. So how can somebody tell that this chest pain is gastric and not related to the heart? Well, first thing is, if you have chest pain that has started for the first time, you should ensure that there isn't any heart-related issue. The kind of patients I see in my medical gastroenterology practice is the ones who have been already to have checks done for the heart and they've been told that there is nothing wrong with the heart. Heart and the food pipe are next to each other. So sometimes the pain can be difficult to tell from one to the other. Let me give you a few illustrations as to what is gastric pains. If the chest pain is more in the center and if it is mostly of a burning type or a burning sensation, that gets relieved by a glass of water, by taking an antacid medicine, by taking a glass of milk, then it is a gastric type chest pain. If the pain is specifically coming on after eating certain foods, for example, you may have eaten something heavy like biryani or some masala rich foods, and if it is coming specifically only after certain foods, that again points more towards the gastric type of pains. If the pain is associated mostly with a lot of bloating and gassy feeling, and then you burp it out or you pass gas from below and you feel better, that is gastric pain. If the pain just gets eased by just going for a walk and you feel lighter, that again is gastric pain. If the chest pains are lasting for only a few seconds here and there, just like sharp pricks here and there, that is not heart related. That could be just spasms, gastric related chest pains. Sometimes the pain, some people point that it is just in one particular place and it is sore in that area. So if you were to press, if it feels tender or if it feels more painful to touch, that again it isn't heart, it could be just a muscular pain. So this way you can tell that these pains are not from the heart. What causes chest pains from our digestive system or gastric pains? So chest pains obviously can be alarming and it can be scary. And if we see people going to the hospitals in the night, almost 8 out of 10 people, they will be told that there is nothing wrong with their heart, but patients don't quite know then what next, where to go, because they keep on getting these pains. So the common cause of non-heart related pains is this gastroesophageal reflux. So the backflow of acid in the stomach coming into the food pipe that can cause irritation to the lining of the food pipe. In some people, there is a lot of pressure in the food pipe, what we call as esophageal spasm. So the food pipe, instead of gently squeezing, sometimes it is doing this kind of a twisting movement. So that can also give pain, but it is a very quickly relieved pain, and also sometimes the pain is specifically coming on during eating. In some people, they do not have severe reflux of stomach acid or they do not have high amount of pressure in the food pipe, but their food pipe is just extra sensitive to even small amount of acid and small pressure changes in the food pipe. Some people might also have gallbladder stones where the pain can start in the center and can go through to the back, and the pain can be very intense, lasting for half an hour to an hour, and then it settles down. This could be a muscular pain where you may have lifted something heavy or you may have pulled a muscle in the chest without realizing, and that particular pain tends to come on certain movements and or when you cough, sneeze or take a deep breath. Some people suffer from anxiety, panic attacks, stress, and that can also cause spasms in the muscles in our chest, and that can also cause chest pains. I get asked, are there any tests to confirm that these are gastric related chest pains? See, the important thing is to ensure that this is not heart related, and like how we do tests for the heart, sometimes we might have to do tests to check if this is gastric related. But quite often we take a detailed history from the patient to see when is the pain coming, what is the nature of the pain, how long it lasts, etc. And then sometimes even doing simple blood tests, like they could have vitamin D, vitamin B12 deficiency, that might also be causing some issues. So these are simple things to correct. If we think it is an acidity related issue, sometimes just by giving simple anti-acid medicine for a few days might sort out their problem. But those who are suffering from chest pains repeatedly and have been told that there is no heart issue, those patients we like to look into it, because it is not a nice thing for anybody to keep getting chest pains regularly. So in such patients, we might sometimes have to do an endoscopy, which is a simple camera tube examination of the food pipe and the stomach. And also sometimes we have to measure the pressures in the food pipe, what we call as manometry, to give us some further information to help us guide in the diagnosis and give the right treatment. So there are very simple tests sometimes we may have to do, but quite often it is sometimes just talking to the patient and giving them simple reassurance and making certain changes to their lifestyles. What foods to avoid, or lifestyle changes that you can make to avoid getting these gastric type chest pains? When you're eating food, you need to ensure that you are chewing the food thoroughly and not eating in a hurry-burry manner, because people who are rushing through their meals sometimes are swallowing more air, and the air sometimes gets trapped in the food pipe. It neither comes through the mouth or it can't go into the stomach. So the trapped air in the food pipe can sometimes cause severe discomfort or chest pain. If you are smoking, you need to quit smoking, because one, it will be good for the heart. Secondly, people who smoke also swallow more air that can get trapped inside. Keep the alcohol intake to minimal. If your diet is rich in non-veg, especially high amount of fat and masala-rich foods, try and keep it to minimal. Exercising regularly not only helps improve our digestive system, but it also improves our stamina levels, improves our mental well-being, and this has an overall benefit on the rest of our body. If you are regularly consuming carbonated drinks like colas, you should try and avoid or completely eliminate it. If you do take a lot of coffee and tea, try and keep it to a small cup morning and evening. If you already have some degree of acidity, this reflux or this burning sensation and getting these chest pains, you may have to cut down on taking any sour foods, or especially acidic foods like lemon, tamarind, and in fruits, oranges, pineapple. So all these changes in terms of following a healthy diet and regular exercise can help you prevent getting these gastric type chest pains.